Let's talk about people with bone loss in their teeth. So, what are the first main causes of these issues? So, first, if you extracted the teeth and did not do something to fix it, like put an implant, bone around that area will separate to other parts of the teeth, leaving a gap, causing you to have some bone loss. Another reason is some genetics that cause you to have excessive bone loss early on in your life. This normally happens to people with old age, so 50 and above. They start to have bone loss in their jaws, removing the tight grip on their teeth. These are the main causes of bone loss. Now we have a few options to deal with them, varying on different situations. So the simplest thing what we can do is, if it's minimal bone loss, what we do is we do bone grafts. Okay, so in that area, for example, you want to have an implant here but have a little bit of bone loss, what we do, we can do synthetic bone grafts and we're able to put an implant there. Or we can do a crown connected with like a bridge to do something to take care of that since you have bone loss. So there are a few options. Now, people with extreme bone loss, let's say, for example, in this area, because this is where mostly it happens, where bone grafts are not enough. So there are a few options. We can do a bone graft transfer. So either they take some bones from your jaw, they take some from your hips, and then we implant it here. It's a surgical procedure. This is another option that we can do. And the final option, there's a new type of implant that's called zygoma. It's a really long, almost like this long of an implant that they drill it way into your jaw, here and here. So we do four, and it helps us get a very good grip on your bone, because the normal implant, which is almost this long, it will not be enough to get a normal strong grip on your teeth. Of course, there are other also different types of treatments. For example, let's say you have the bone loss in this area, we can do some four implants here in this area if the bone is still good, and we can do an all on four. So we put four in this area, implants here, and then we get a full set of teeth just like this, for example, and it will be connected with only four here, and then you'll put it and we'll screw it here. It's called an all in four. So these are the few options that we can offer for you guys. And um, the best advice that I can give you is early treatment for bone loss is much better. The more you delay it, the more the bone loss proceeds, and the worse it gets, and the more difficult and the more expensive. So treat it early on. Make sure if you have a tooth extracted, make sure you have a plan to take care of that, because it will start the bone loss journey. So take care of yourselves, and if you have any questions, please feel free to ask us. We'll be happy to help you.